Welcome to Zoom. Enter your meeting ID. Enter your participant ID followed by pound. Otherwise, just pound. You are in the meeting now. You are the first participant. Please stand by. This meeting is being recorded.
There you go. Perfect. The echo should go away as I get further away. I can't hear you guys. You have to unmute. So in participants, there you go.
You hear me now?
Yep, perfect. No echo, no nothing. Everything sounds good.
Praise the Lord.
All right,
you,
do I
Mike.
sound okay?
Yep, you sound great.
Okay, perfect.
Um,
SS, meeting in-home supportive services public authority, Board of Governors meeting to order. That they did meet in closed session, and under closed session, direction was given to staff. I've been told by our county council we should at least announce that and offer public comment. So if anyone has any public comment on the in-home supportive services public authority at this time, now is the time. And if I don't have anyone approach right now, I'm going to close the meeting. Thank you. Good morning.
Hi. I met you last time, anyways, so, you know, we've been fighting this, whatever, it's not a fight, but we've been doing this for almost 2 years now. I don't understand how it's so hard to get such little. We're not asking for much, we're asking for something that's fair. Okay. A second here. Where's my piece of paper? Okay, so this crazy negotiating dance that we've been doing for almost 2 years for $2. It seems insane to me that our elected officials, our Board of Supervisors, could show us such a lack of respect. After all, we play an extremely important role in this community. We take care of people that sometimes can't take care of themselves. It could be your family members. And we do it with pride and respect for them. If they didn't have IHSS workers, some of them would be in facilities. And we know how much that's gonna cost. Okay, so I'm sure you don't like the increase in cost of living, but I bet you don't have to put things on a credit card at the end, because we do. We have to pay for gas, we have to, you know, pay for PG&E, rent, water, propane, plus buy food. It just seems ridiculous. I see, because I've been on your website, I see how much people are getting paid. You know, whether you have one of your employees that is making $500,000, and she got a $90,000 raise from 2019 to 2020, and then she got another raise from 20 to 21. How is that even? We're asking for $2, $2 and some change. It just doesn't seem right. We work hard and we have heart. And it's hard to get anybody else that wants to come to this, wants to be an IHSS worker, that wants to be in this field, because they could go anywhere else and make more money. It doesn't, we have to be able to bring other people in. We have to bring other people in that will enjoy this job, that will love this job. But you gotta give them a little incentive. Just, I don't know, I wrote all kinds of stuff, blah, 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 blah. Okay, so we're paid by the county, but we're not county workers. We're paid by the state, but we're not state workers. Where are we? What are we? We're in the middle, we're like orphans. Just throw us a bone every, you know, just, Okay. It's hard for me. Okay, so, and let me just add that our job does not end when we leave our clients. So if I wasn't gonna do that, we take them home with us. I don't mean physically, but mentally. We try to figure out, you know, what's gonna make their life better. You know, are we gonna get to the doctor's appointments? Are we gonna get their prescription? Are we gonna, I mean, we play so many different roles. You don't see it, but we do, and we know it. And I just don't think that we're asking for too much. And that's about all I got to say. Anyways, thank you.
You?
Hello, my name is Lupe Smith, and I'm here again. And I'm gonna keep coming again and again and again until they get a fair pay. I mean, have you guys seen the groceries, how high the prices are? We barely make it, paying our bills. Sometimes we barely have enough to put on the table. And you know, if you really think about it, one day you guys are gonna be recipients. And how would you like it? Your provider cannot come to see you or take care of you because they ain't got no gas. And this is what's happening. There's a lot of providers that wanna come, but they ain't got enough money to come for the gas. And you gotta think about this, because we're all getting old, and we're all gonna need someone to take care of us. And, you know, just think about it. Thank you.
Thank you. Come on up, Pam. Can you pull the microphone down, please? Thank you.
Because Santos shirt, sorry.
No.
My name is Clara Pullman. I'm in Home Health Support Services. This is my first time to attend this meeting. Sorry, I get like Sophie. So anyway, I've been working for this in Home Health Support Services. And the benefit that we get for taking care of our people is not good enough. Okay. We don't have a good health care. We put our life on the line. During the pandemic, who they can count on? Us. We put our family, loved ones behind just to take care of these people that didn't really need help. I'm only the person working. My husband is not working. How can I provide food, pay the bills, for the money that I make? I'm trying really hard to make a living, okay? And the way it is right now, $15 an hour, not enough. We're asking for just a small amount that you guys can provide us. We respect and proud of what we do for our community. And when they're sick, who they call us in Home Health Supported Services? When they need help, who they call us? They don't call their family, they called us. Sometimes we work 10, 12 hours a day. Sometimes we don't put the streets because they need us. So we're asking for you guys to give us something because I think we deserve better. You guys been elected to be putting us also. We're, I'm sorry, my word, I'm so emotional right now, but I don't get, you know, I'm proud of what I do, and I would never quit my job because I think it's worth it taking care of people that really need help. I've been working for these people that I work for 9 years, going to 10 years. And I start from $8, $7 when I started, and I've been this in Home Health Support Service for 10 years. But I try to be patient. That someday, you guys can give us a little more. Thank you.
Thank you. Good morning.
Good morning again, Manuel Arias, SCIU 2015. I'm the union representative for San Juan, King, Calaveras, and Amador counties. And I just want, I've also worked all across the state, doing external work, meaning organizing new shops in nursing homes. And I've worked in great many counties, and Amador County is very unique. And I think what you hear, in the voices of the workers here is the added stress that they experience, taking on 3 or 4 clients, consumers. We call them consumers. Everyone else in the state of California, they're able to have one, maybe a family member and a neighbor they'll take care of. But here, the average is 3, 4 people. And that's 3 or 4 loads of emotion, healing, sickness, stress, managing people's time, medicines, emotions. And it's like that because we can't get enough people to do this work. And we can't do that because the cost is prohibitive. You can't survive $15 unless you have support around you. And which makes the problem here a little bit more difficult is that we're experiencing something what we call the silver tsunami, where the baby boomers are retiring, getting to an age where they need support services. And to make life more manageable, they move to the foothills, to the Sierra Nevada mountains. They come to Amador and Calaveras and retire here, to the place where we have no providers to support them. So we're negotiating. We continue, and we're very happy that we're having productive negotiations with your representatives, and we look forward to coming to some agreement real soon on how do we make this profession more attractive so we can meet the need. And so I just want to thank you for your time, and I'll probably see you soon. Thank you very much.
Thank you. Thank you. Good morning.
I'm short a little bit too, so I'm gonna lower this, even though I'm a little bit taller than my mom. My name is Gina Castellano, and I'm the executive board member for SEI Local 2015, which you know we are now the second largest union in the state of California, representing long-term care. Care providers. When I come through this community, I think this community clean here. It's very clean, and you must take a lot of pride, and you invest in your community. And I'm hoping that you will invest in the workers that you have here that are providing quality care for the most vulnerable members of society, which is our seniors, which, looking around, we're not there far, or we are there now. And we need to continue with quality care. And I'm hoping that when I come through this community and I see that you respect your community, that you respect the workers as well that you have. Home care is not an easy job. It's not. A lot of times the home care provider is the therapist, is the person that's changing the catheter, the person that's sitting there or taking the client to their home for Christmas, for the holidays. It's true, it does happen. They're the ones that know more about the client that they're providing care for than their own family members. True. It's a reality that we deal with. And I'm hoping that you will continue to support the workers of your community, which are your constituents, and lead the way and make a strong statement for this community that we support our workers. I'm too getting a little emotional because hearing them cry about how passionate they are about the care, the quality care that they are giving. And I know it resonated in this room because you've seen them cry. That shows you how much passion they have in providing care. And I say quality care because they could have walked away. Home care providers are unique and often unrecognized. But they're the ones that are the frontline workers. They're the ones that are making sure that their client is getting a good diet, especially as seniors. It's really important for us to have a good diet, right? Vitamins are expensive. They are fresh food. It's expensive to eat healthy, right? But you need to invest in your workers so that they can continue to be able to do the work to make sure that their clients are also taken care of as well. Walk a day in their shoes. See the work that they do. They're just not sitting there with the remote control looking at a television. They're doing the menu planning. They're also putting their own gas. So you hear about gas, we all know how expensive it is, to ensure that their client is getting a good diet. They're getting their medication. They're going to the doctor's appointments. There's sometimes the plumbers. Seniors on a fixed income cannot afford a plumber. Maybe y'all can, but I know I can't. I use Drano, okay? And I do it the old-fashioned way with a hanger. I mean, we've done it, you know. See? So, you know, recognize them, please. And like I said, when I come to Amador, I think, God, they care about their community. Look how clean it is and how polite the people are. Made me want to kind of move over here. Yes, support your workers, please. Make a statement. Remember, we're all looking at here, well, maybe you and I are close, but we all need to respect our seniors. We're not too far from it. And the silver tsunami, oh my gosh, this is what scares me, is that we don't invest in the workers that are frontline workers. Who's going to do it? Nobody's going to do it for $15 an hour. Think about it. Y'all know it's true. So again, you know, the seniors in this community have invested and have worked in this community, have been taxpayers, and the seniors in this community are like the founders of this county, and you know it. Let's respect them. And again, I'm getting a little emotional too. I was shocked to hear about their contract, that they hadn't had a pay increase in so many years. I said, that can't be true. That cannot be true, but it's true. Let's change it. And again, I didn't come with a speech. I didn't write anything down. I just came because these workers need to be important to Amador as well as the community is important to you. Please just respect the workers. Thank you.
Thank you. Good morning.
Good morning. Just a reminder, my name is Adriana Jensen. I live on a property in Amador with my mother, and I am her caregiver. And I just want to say that there's so much more that we do that doesn't get accounted for. So my mom is what they call Medi-Medi, low income, right? So she gets Medicare, and then the part that normally people need to pay out of pocket, Medi-Cal picks up because she's, you know, like I said, super low income. But there are some issues getting access to healthcare in Amador. So when I take her to the doctors, I have to take her to Sacramento. That's an hour and a half each way. So 3 hours round trip. I don't get paid for travel. I get paid for sitting at the doctor's office. Or when a couple weeks ago, when I thought I was going to lose my mom because she was so sick and I had to take her to ER in the middle of the night, when she's at ER, I don't get paid. I don't get paid to take her there, to sit there, to talk to the doctors. I don't get paid for any of that because when she's in the hospital, I can't put hours there. Let's say she spends 5 days in the hospital. The time I go and spend cleaning her house, getting things ready, getting her bed set up, whatever she needs, I don't get paid for that because she's in the hospital. So there's a lot that we do that we don't get paid for. So when you start counting that in, what are we making? $3, $4, $5 an hour? I mean, realistically, for what we're doing. So that's why I'm asking for you to consider giving us a little bit more. We're not asking so that we can just go have fun and do a bunch of things. We're asking to be able to cover that gas money. The gas money to get my mom to the doctors, that comes out of her pocket or mine. In order to save money, we batch schedule, meaning we do a bunch of other things that's hard on both of our health. because it saves on gas money, but then we also need to eat out if we're gone for 8, 9, 10 hours taking care of these things. So I'm asking you to help us just cover our necessary needs. Thank you.
Thank you. Good morning.
So, my name is Sarah Deacle. I had a massive stroke when I was 44 years old, and my family was very, very supportive. They had me move into this area so that they could take care of me. But that care was very short-lived. Sorry, I'm having a hard time standing. Okay, so they, because they all work. And so I had to call the IHSS and get workers because I need it. And the IHS workers, they're very, very sweet, and they take care of me long term. But if they're not getting paid enough, that's a problem for me. And when they don't have proper health care, that's a problem for me. And because sometimes they have to take a couple of days off to figure out, what they're going to do with their health. And when that happens, I'm stuck alone at my house trying to care for myself. Okay, and I can't cook, I can't clean. And like she was saying, sometimes I have lots of doctors in Sacramento, and I lost a caregiver because she didn't want to drive to the doctors in Sacramento. And I've had several heart attacks recently, and like she said, I was in the hospital for I think over a week, and that means my caregiver can't work. She can't, what is she supposed to do for an entire week without a job because I'm in the hospital? So there's just some issues that need to be taken care of. They need proper care and they need proper health care, because when they do, then we're going to be taken care of, the way that we need. And I'm just saying, you never know when things are going to happen, when your life's going to change. You think, okay, I'm healthy now. I was healthy at 44, ate a good diet, all of it, and bam, in 60 seconds, my life changed. You could have a stroke, you could have a heart attack, and you can be in my shoes, needing help. And your family, as great as they are, they're going to be short. It's going to be short-term health care, for them helping you, because they're going to have jobs and all of that. So you're going to have to call on an IHS worker. So just please consider that, okay? Thank you so much.
Thank you, ma'am. Thank you. Any other comments? Closed session for IHSS. All right, then, we will bring the IHSS meeting to a close and adjourn the In-Home Supportive Services Public Authority meeting. And now we will go to our Board of Supervisors meeting. Mr. Gilat, Supervisor Neto is, want to address that now?
No, I think we're good.
Oh,
Yeah, we're good.
okay. Supervisor Neto is not feeling well, but he is attending the meeting remotely. And appreciate anyone, if you're not feeling well, staying home, supervisors or public. Thank you. The board did not meet in closed session. We were in the in-home supportive services, so there's no action on closed session items at this time. Oh, at this time, can we all stand for the Pledge of Allegiance? I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty. Thank you. We'll go to public matters not on the agenda. Discussion items only. To action to be taken. Any person may address the board at this time upon any subject within the jurisdiction of the Amador County Board of Supervisors. However, any matter that requires action may be referred to staff and/or committee for a report and recommendation for possible action on a subsequent board meeting. There is a 3-minute time limit. Is there any public comment at this time? Have a hand in the back first, and then in the front, and then over here. Yes, ma'am, good morning.
Good morning.
If you could sign in for the record, please, if there's a pen
Sign
there.
in here, absolutely. My name's Lori DiAgostini. I've been
Morning.
attending a few of these board meetings lately, mostly due to the Sherwood Forest residents, but there's a few other things that has really spiked my interest regarding the responsibilities of the Board of Supervisors and the power that you actually have for Amador County. So I thought I would attend today. I almost got up and spoke for your IHSS workers. I'm very fortunate. I raised my 3 sons in this county by myself, no child support, no nothing. And I was fortunate enough to work for Department of Justice, Department of Corrections, and California Highway Patrol. I'm a retired CalPERS, and I currently work as a retired annuitant for CalPERS. But in the time of raising my children, it didn't matter how much I make, you can't get by. So I worked for IHSS. I went to work for them, and I can't tell you how physically demanding that job is, to take care of people that aren't able to take care of themselves. So first of all, please consider those people and giving them a raise. They deserve it, probably more than most. You can go to McDonald's and make what they make and not have to take care of another human being, and I think that's sad. Secondly, our law enforcement deserves a raise. Our sheriff's department do not make what the other sheriff's departments make. And with that being said, our seasoned sheriff's officers are leaving for higher salaries than other counties, and I would like you to take into consideration. However this works, I don't know how it works, of looking at what our sheriffs makes compared to what other sheriff's departments make in this state, and consider giving them a raise so that they'll stay here in our community, because we deserve to have them here for our protection, for the service that they provide. And there was one other thing I wanted to bring up, but it slips my mind at the moment.
I'll let you sit down, you can come back up when you remember it. It happens to me all the time.
Okay, thank you. It must be my age, I guess, so, but I'll have a seat and I'll remember.
Okay, just sit right in front. If you're like me, it'll happen as soon as you hit the seat. Okay, Mr. Bixby.
I didn't come here to talk about those 2 issues. Former life, I spent about 40 years involved in long-term care. I used to be administrator. It's not the nurses, it's not the doctors, it's not the administrators, it's the direct care workers that make the difference in their lives. It is. Sorry for that little editorial.
That's all right.
So my name is Greg Bixby. I am a resident of Plymouth. I'm here to discuss just 2 documents. In full disclosure, I'm a supporter of Ryan Gillespie for sheriff, so let's get that out of the way. The 2 documents, and by the way, I am not going to read any of the accusations from any of these documents. They are beyond adult content. And I'm not going to ask you to offer an opinion on whether or not the accusations were true. I'm only trying to get to one thing, whether or not the 2 documents are genuine. Do they exist? Are they real? Now, I think we all already know the answer, but I'd like to get it on the record. These 2 documents, just for the purposes of identifying, again, not going to read any names, except maybe the names of the attorneys. There's a 25-page document. Starts out at the top with a lawyer's name, William Wright, and on page 25 it has the signature of that attorney, and he appears to be attorney for plaintiffs. Second document is, depending upon which version you got, is 4 or 5 pages long. It appears to be a settlement agreement between the parties. These 2 documents are out there in the public domain now. They're all over the internet. They're being discussed. Some people think they're real, some people don't. Some people want to deny them because of their beliefs, their agendas, whatever. They're entitled to their own beliefs, but Just want to settle whether or not these are genuine. So document number one basically is, three individuals who, were former employees in the jail, working for the sheriff's department. And the defendants were a supervisor, again, well, I will not name, in the jail, and the sheriff coroner. The accusations that are in here, again, I'm not asking you to say whether or not they're true. The accusations are horrifying. They're beyond demeaning. They're the worst I've ever seen, I've ever read. And if true, wow, I don't even know what to say.
I'm gonna just caution you on time. You're at almost 3 minutes right now. So I don't wanna cut you off prematurely, but we do allow 3 minutes. I'll give you another minute or two.
Thank you. And then there's a settlement agreement, okay? And so here's what I would ask you to do. I would just ask you to acknowledge that these documents, and I delivered copies of this to your offices, including the county council yesterday. I know you've seen these before. I know you took action. I believe you took action on this settlement agreement. I would just like you to acknowledge whether or not these documents are genuine.
Would you like me to
Counsel.
respond?
Yeah, please.
So, yes, this is a complaint that was sent directly to me by the attorney for the plaintiffs, which the county investigated. And eventually, we went to a mediation, with the plaintiffs, and that is the settlement agreement.
Thank you.
But the lawsuit was never filed, correct?
The lawsuit was never filed, but we engaged with the plaintiffs. We conducted an investigation, and, that's the outcome.
I would beg for a little extra time because I think this question and answer are misleading. I would agree that a lawsuit was not filed, and in fact, you nailed it, okay? There are people out there saying, hey, this document doesn't have a case number. Oh, I can't find it in the Calaveras County Superior Court case search. I can't find it, so it must not exist and so on. True. It was written up in that form. It's titled that way, but then my understanding is it was filed under the rules and regulations of the Fair Employment Housing Act. It was felt that, or determined that that was the proper venue. Call it an administrative court, call it what you want. It was a claim, which of course lawsuits are claims too, right? So I see you're shaking your head, and I'll be quiet in a minute and listen. It was claims, accusations and claims were made. They were addressed. The county participated. There's a settlement agreement that includes $150,000, things like admonitions to defendants to not do certain things, and even including things like an order or a demand that the female employees actually get to wear female uniforms. Just imagine, okay? So, isn't that accurate? There was a claim.
So I don't know anything about, Fair Employment and Housing Authority claim. This was emailed directly to me. It's captioned as a Superior Court caption, which actually says Calaveras.
Right.
Which is not true. They wouldn't file in Calaveras, they would file in Amador. But it is basically a draft of a complaint, a lawsuit that was sent to the county. And as you said, they're serious allegations. We took them very serious. We conducted an investigation. There were no complaints of this nature before this came as an email, so we looked at it, and then we resolved it through the settlement. The settlement contains some things, and I just want to say, my understanding is the sheriff's, the correctional officers have always had an opportunity to buy female uniforms. We showed them during the mediation. We agreed to it because they asked for it, but it's already being done. It's not something, you know, and the settlement, and the cost of the litigation is primarily covered by insurance. So the cost of the county for this lawsuit is $10,000.
Okay, I don't want to go back and forth with an argument. I'd like you to wrap up your public comments, please.
and I would have had those wrapped, and I will, okay? But, Mr. Gilat, I didn't ask you who paid, I asked this board, are these documents genuine? We know they're genuine. You provided them based on an official records request. They came from you. So we know they're genuine. I would just like the board to acknowledge they are genuine. Not here to talk about the particulars. I didn't start it. I'm not the one, okay? Well, Mr. Gilat, I'm gonna wrap it up. So I would just like you, I'm asking you on the record to acknowledge that these documents are genuine. Will you do
You're
that?
speaking under public comment. I'm not gonna ask any board member to acknowledge anything. So can you wrap up your comments, please?
I already answered that question.
They are genuine.
This is the document that was sent to me.
Thank you.
And I produced it as a public
Thank
record.
you. I'm gonna wrap up just by saying, I would encourage the voters and citizens to get these documents, read them, make their own determinations on whether or not they believe they're true, who may or may not have known about it, who may or may not have taken any action, and decide what you think you should do. Thank you.
Ma'am, you were next up. Okay. Good morning.
My name is Sarah Lebowski, and I am a resident in Amador County. I live in Pine Grove. And I just had a couple of comments for the board. I did email Supervisor Jeff Brown. Thank you so much for your response. And that was on several different topics of concern in the county. Some of them have already been addressed here this morning, including the increase in pay for the sheriff's department, having to travel so far out of the county for medical services. It's certainly a burden for all of us, including some of you on the board. And so I'd really like to see some actual actions in terms of some of these things being addressed. I keep hearing, you know, well, yes, this is frustrating. Yes, I'm dealing with it as well. And I've talked to many residents throughout the county. This is not getting better year after year after year. It's just getting worse. So I'm just hopeful and, feeling a little ambitious that this county could pull something together and have some actual actions in terms of addressing some of these issues, in terms of being able to provide if it's monetary incentives so that we can have enough doctors, medical services, ambulances, sheriffs, what have you for this county, because it's just growing and it's becoming a bigger issue and it's going on for years and years and years. And I just don't see any action. And as a mother, I'm very concerned about that. My husband had a heart attack this last year and he's 44. And so it's a genuine concern. I don't know that we could stay in this county if some of these issues can't be resolved. And I just don't see any actual movement of that. So I would ask that the board please show some action in kind of resolving some of these issues for your constituents. That's all I have. Thank you so much.
Well, I know Sutter Medical has a program to bring more physicians to the area, but it is a real difficulty to recruit physicians to a rural area.
I understand that. I absolutely do. And
A lot of times, they don't really, want to stay long-term, or maybe their spouse wants to live in a more urban area, so they're trying to overcome that. But there is a real need. There's no doubt.
Thank you.
Thank you, ma'am. Ms. DeAugustini, you have total recall?
Total recall. So, yeah, the other issue I wanted to address was I just happened to be here when ACES asked for more money due to the increase of gas, the cost of gas. Well, my take on this, and I wish I would have said something that day, I've known Paul Molinelli Jr. for years. My youngest son and his son were best friends from the 3rd grade, and I didn't stand up and say anything. I wish I had. Don't give them more money. We, the consumers, get to pay more money for gas. And now you give them more money for their services. We get to pay more money for waste management. You see the issues with people dumping their trash all over the county. when you can't afford to take your trash to the local dump and you gotta dump it on the side of the road, I don't think increasing the cost to dump our trash at ACES is gonna help the situation. So-
Contractually, they're allowed to ask for a surcharge if gas prices go beyond a certain amount.
Okay, so can I ask you to reduce my property taxes because I have to pay so much more due to a cost of living?
You can ask.
Please do. That's all I have to say. Thank you for your time.
Thank you, ma'am. Are there any other public comments? Hearing none, any board members? Supervisor Onetto? Hearing
Well,
none,
no,
we'll
it's,
go- Okay,
yeah, I
thank
will
you.
make a comment, actually, Richard. I mean,
Oh, okay, go ahead.
what we're seeing, I think everybody's getting pinched, if you ask me. You look at, food prices, gas prices, they're all going out of sight. I feel sorry for people that are workers for private businesses. I feel sorry for public employees, county employees. I mean, because the pinch that's going on it's ugly, but also I see what the county's costs are doing. Our costs are going up too. So, do I see any silver lining anywhere? No, I don't. But that's just a fact I'm putting out. Anyway, that's all I have to say.
Well, the silver lining is gas prices were pushing $6. Now I guess we're happy that it's just over $5. I'm not happy, so.
Well, we shut down pipelines, we shut down drilling, we shut down this. We're going green, and that going green may happen in time, but as a nation, we're forcing it, and it's not going to be pretty.
Okay, thank you. Any other comments, board members?
No.
All right, we'll go to approval of the agenda.
Move to approve, Mr.
Before we do that,
We
we
need
do
to
have
add
one
put the
addendum.
addendum on, yeah.
For the addendum, I'd like to place as item 4D on the agenda after the minutes. The addendum is administrative agency consideration and possible action supporting Measure J. So with that, can I have approval of the agenda?
So move.
Second.
Moved by Supervisor Cruz, second by Supervisor Axe. Any further discussion? All those in favor?
Aye.
All opposed?
We have to do a roll call, don't we?
Yes, we do. Roll call.
yeah, I forgot.
Supervisor Crew,
Aye.
Supervisor Forster,
Aye.
Aye.
Supervisor Brown, Supervisor Axe,
Aye.
and Supervisor Onetto.
Aye.
All right, motion carries 5-0. Approval of items on the consent agenda.
Move.
Moved by Supervisor Brown, second by Supervisor Crew. Roll call, please.
Supervisor Crew,
Aye.
Supervisor Forster,
Aye.
Supervisor Brown,
Aye.
Supervisor Axe,
Aye.
Supervisor Onetto.
All right, motion carries 5-0. Thank you. We will go to our regular agenda. Item 4A, update by Amador County Health Officer, Dr. Rita Kerr, on the COVID situation in Amador County. As you know, this is a once-a-month report now. And we'll get Dr. Kerr up on the screen.
Good morning, are you able to hear me?
Hold on, Dr. Kerr, you're still very tiny.
Okay.
There you go.
Good morning, how's the audio?
Morning.
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 Sounds like you can hear me. Good morning, Chairman Forster and supervisors and community of Amador. Here to give the monthly update on the COVID-19 situation for Amador County. More highly contagious subvariants of the Omicron strain of the coronavirus continue to circulate in our community. The currently dominant strain, BA.5, evades prior immunity to cause infections, but fortunately, treatments remain effective and vaccination continues to provide protection against serious illness and death. Therefore, the impact to hospitals is less than during previous waves of COVID activity. Currently, there are 5 COVID positive patients hospitalized at Sutter Amador, with one of them in intensive care unit. And to date, 393 Amador County residents are known to have been hospitalized because of COVID-19, and that's an increase of 22 individuals since my update last month. The average length of stay for hospitalized patients is shorter now than it was during the Delta surge last fall and the first Omicron surge, which happened over the winter months. COVID cases and death data is updated on the Amador County COVID-19 webpage every week on Tuesdays. And if you could put up the epi curve, that shows laboratory confirmed cases in the blue bar and probable cases on top in the green bars. And the trend over the past couple of months continues at a relatively high level and has plateaued with maybe a slight downward trend in just the last couple of weeks. That slight downward trend is reflected on the CDC's community level map, which is updated every Thursday. And Amador moved from the high community level to the medium community level last week. The formula CDC uses to assign that level is a combination of local case rate and regionally hospitalized COVID patients. Switching over to the pie charts gives a snapshot of the geographic distribution of cases within the county, and you'll see that every region continues to have some COVID activity. There are currently 66 active Amador County residence cases, which includes confirmed, probable, and suspect cases, which are new in the last 10 days. Case counts do not include unsupervised self-tests, which are not consistently reported to public health. Mule Creek State Prison currently has 20 active inmate cases. Since last month, one additional confirmed COVID-19 death in an Amador resident occurred, a woman in her 90s. And that brings the total confirmed COVID deaths to 79 Amador County residents and 9 Mule Creek State Prison inmates. Public Health was informed yesterday of 2 more deaths that occurred in late July in individuals who tested positive for COVID within 30 days of their death. And those 2 are currently being investigated to find out if those were COVID caused or COVID associated and it contributed to their death. Public Health offers sympathy to all who are grieving the loss of a loved one because of COVID-19. Moving on to the COVID vaccine update. The COVID vaccines are available and free for everyone 6 months and older. COVID vaccine clinics for those aged 5 years and older are held at Health and Human Services at the back entrance on Tuesdays from 8:30 to 11:30 in the morning and Thursday afternoons from 1 to 4. Primary series and booster doses are available at the Tuesday, Thursday clinics, and you may schedule by visiting myturn.ca.gov or calling 1-833-422-4255 for an appointment. Those with appointments are prioritized. Walk-ins are accepted but must arrive a half hour before the clinic end time. Retail pharmacies also continue to offer COVID vaccines, and the availability of which product they have in stock and their appointments may be checked at vaccines.gov website. Parents who are interested in having their children aged 6 months through 4 years old vaccinated should talk with their doctor or may call Public Health at 209-223-6407 to schedule an appointment. A parent or legal guardian must be present at the vaccine appointment visit. Novavax is another newer COVID vaccine option now available for adults age 18 and older for primary series doses only. It is not yet authorized to be given as booster doses. Novavax is a protein-based vaccine that uses technology similar to others that have been used for decades, such as hepatitis B and shingles vaccines. It requires 2 doses given at least 3 weeks apart, and Public Health has Novavax in stock for use at the Tuesday, Thursday Health and Human Services building vaccine clinics. Regarding the vaccine data for the county, 57.7% of the total population of Amador County have completed a primary series of COVID vaccine. 69.3% have had at least 1 dose, and 30.7% of the population in Amador County have not had any doses of COVID vaccine. The age group breakdown of those who remain unvaccinated is 97.5% of those under age 5, 81% of 5 to 11-year-olds, 51% of 12 to 17-year-olds, 47.5% of 18 to 49-year-olds, 13.5% of 50 to 64-year-olds, and 2% of those age 65 and older. The priority remains for those who are still unvaccinated to get protected, and the average first doses given were just 2 to 5 per day over the last month. Everyone who's age 5 and older is recommended to get 1 booster dose after completing their COVID-19 vaccine primary series. The timing for that first booster is if it's been at least 2 months since a single dose J&J vaccine, or at least 5 months after the primary series for Pfizer or Moderna. Anyone who is 50 or older is recommended to get a second vaccine booster if it's been at least 4 months since their last dose. Additional booster doses are most important for those over age 65 or those who have underlying conditions that put them at higher risk for severe COVID-19 illness. Given the widespread community transmission of COVID-19, these groups should not delay getting their boosters once they're eligible, even anticipating the upcoming updated bivalent vaccine boosters planned to be distributed in the fall. The mix and match option remains available for adults who may choose a different vaccine for boosters than they got for their primary series. And if you come for a booster, please bring your vaccination card, a photo of it, or a digital verification record showing the dates and types of previous doses you received. The COVID-19 mobile vaccine team continues to provide vaccination for homebound individuals who may schedule a nurse home visit by calling public health again at 209-223-6407. Moving on to testing and treatments, self-testing options remain widely available. You may continue to order free delivery of at-home test kits via US mail by visiting covidtest.gov. More accessible tests for those who are blind or low vision are available to order by calling 1-800-232-0233, and that is a federal program for distribution. Antigen self-test kits are also available for distribution to the public by local agency partners who've been working in cooperation with public health for state supplied test kits. And if you test positive, please follow current self-isolation guidelines and inform your close contacts. The OptumServe testing site at the back entrance of Health and Human Services, Suite 500, remains open on Mondays, Wednesdays, and Fridays from 7 a.m. to 3 p.m. You may register for the supervised rapid antigen tests at lhi.care or by calling 1-888-634-1123. PCR swab collection to be sent to the lab for testing is still available upon request at the OptumServe site, and masks are required to be worn at both the vaccination and testing clinics. I'd like to note that due to the upcoming Labor Day holiday, the OptumServe site at Health and Human Services will be closed on Monday, September 5th. The following day, Tuesday, September 6th, from 7 a.m. to 3 p.m. will be a makeup testing day for OptumServe, and no COVID vaccine clinic will be offered at Suite 500 on that Tuesday. The OptumServe sites continue to offer test to treat, which means that persons who test positive for COVID-19 who are at elevated risk for severe illness are offered an on-site telehealth visit to speak to a provider about COVID oral antivirals, Paxlovid or Molnupiravir, and they'll leave the site with treatment in hand if they're eligible. Those medications are provided free of charge. These treatments work best when started as soon as possible after symptom onset and must be started within 5 days of symptoms. It is necessary to bring a complete list of all medications and supplements that you're taking with you to the test site so the provider can screen for potential drug-drug interactions. Healthcare providers, such as your own doctor and urgent care clinic, can also prescribe these antiviral medications to symptomatic patients who are at increased risk for developing severe COVID illness. Local pharmacies have the pills available for pickup with a prescription. Sutter Amador has Paxlovid pill packs, as well as injectable monoclonal antibody therapies in stock to treat higher risk individuals who test positive for COVID-19. Prevention is still the best medicine. Being fully vaccinated and getting a booster when it's time remains the safest way to prevent serious illness, hospitalization, and death from COVID-19. Evusheld is an injectable medication that can be given every 6 months to prevent COVID-19 infections in persons who cannot receive a COVID-19 vaccination for medical reasons or whose immune system is not strong enough to mount a response to the vaccine. Evusheld is available locally at the Sutter Amador Infusion Center with a physician's referral. COVID transmission remains elevated in our community, so consider your own and your family's risk when making decisions about precautions. Recommendations are: stay up to date with COVID-19 vaccines. Get tested if you've been exposed before and after travel, and or if you have symptoms. Wear a mask if you have symptoms, a positive test, or exposure to someone with COVID-19. Wear a mask on public transportation. You may choose to wear a mask at any time to protect yourself and others. If you're at high risk for severe illness, consider taking additional precautions, such as being strategic about attending indoor gatherings or events. Prefer to meet outdoors or open windows for ventilation. Anyone who feels ill, even with mild symptoms, should get tested and stay home while awaiting the results. If you don't feel great, please isolate. And I'll be happy to address questions this morning, but before I do, I'd like to make an announcement that you're maybe aware that Connie Vaccarezza, our public health director for many years, retired at the end of May. I'm pleased that Joanne Hassan, a public health nurse, will be joining our department next week as the new Amador County Public Health Director. And she will hopefully also join the Zoom meeting next month when I give my updates so that you can meet her then.
Any questions? Supervisor X.
Yes, Dr. Kerr, I have two questions. The first is, I guess looking at the epi curve, it looks like the surge, is kind of coming down, or it's plateauing, or it seems like it's, it's going dormant again for a while till the next one comes around. And then the other one is the Novavax being a protein. Is it still just the spike protein that that's being delivered to the patient?
It is a spike protein based vaccine. It's not the nucleocapsid antigen, but it is coupled with an adjuvant, kind of like the super flu doses that come every year, the high potency flu doses. So it has a second ingredient which boosts the immune response.
Okay.
What was your question about the EpiCurve, or was that just an observation?
Well, it just seemed like the surge we were having, maybe a month or two ago, there was a big spike, and then it kind of came down, and then seemed like it was going up again, but it seems like it's beginning to come back down. So
it is flattening out.
It's not getting worse. I guess that's the take-home message for the time being.
That is correct as of today. Of course, community levels may rise with the kids returning to school tomorrow, having a lot of people mixing in indoor settings again. Let's continue to hope that the hospital impact would not be significant and that anyone who is affected, that it's mild or illness. Of course, the disruption to individual and family life of having to stay home when people are sick continues to be a challenge, but we're working with the schools to continue to try and take mitigation measures there as the California Department of Public Health guidelines lay out.
Thank you.
One question, Dr. Kerr. think a lot of people are wondering, is this ever gonna go away? Is there a time you envision where COVID will be treated similar to the flu that happens every year?
That's considered endemic, and yes, I think we are moving toward that. There are some particular data metrics that are being watched at, the statewide and the national and the worldwide level. And one of the particulars that continues to be monitored is how lethal this virus is relative to a routine flu season or even a bad flu season. And right now it is continuing to be more deaths per day, right now on the order of about 400 deaths a day nationwide than even a very severe flu season. So we are continuing to have to live with this virus and make adjustments as it continues to mutate, continue to make vaccines and treatments accessible to individuals without barriers as much as possible, and continue to take actions to try and make our indoor spaces as safe as possible. I think the big emphasis that I'm hearing more and more about is engineering controls in buildings to improve ventilation and the number of air exchanges and the filtration to try and lower any potential viral load in the indoor spaces. And that's not going to help only for COVID. It's also going to help for any other kind of illnesses that spread through the air, like influenza. And it can also help out here in the West, particularly with air quality from wildfire smoke and that sort of thing. So there's multiple benefits to really kind of focusing on those kind of measures.
All right, thank you.
I know one thing I would, Mr. Chairman.
Go ahead.
Yeah, this is Supervisor Neto. One comment I have on that is one of my pet peeves is all these modern buildings, I guess due to efficiency or whatever, and trying to control atmosphere in the building. But man, I love windows and all these buildings, and maybe even for security, but these modern buildings, you can't open a window. And I mean, so all your air is being run through, air units, and that's something I'd like to see looked at. Is there a way to maybe some of these modern buildings have windows you can actually open?
Interesting point. And of course, in your home or when you're gathering in a facility that does have the ability to open those windows, I advise you to go ahead and do that.
That was all. Thank you.
Thank you. Any public comment from our vast crowd today? All right. Hearing none, Dr. Kerr, thank you very much for being with us today and for your extensive report.
Thank you.
You're welcome.
All right, have a good day.
You too.
All right, with that, we'll move on to item 4B, Argonaut Mines Centennial Commemoration, Adoption and Presentation of a Resolution commemorating the 100th anniversary of the Argonaut mine disaster. And we have a resolution that I'm going to read. Would you like to come up? You're representing the celebration. Are you representing? No? Do we have anyone on Zoom representing?
Bet you was gonna be here.
Okay, then I'll just read the resolution.
Hey, Linda.
All right. Whereas in 1922, the Argonaut mine was the second richest mine in California, producing more than $25 million in gold before being closed in 1942. And whereas on August 27th, 1922, a fire in the main shaft of the Argonaut mine trapped 47 miners 4,350 feet underground with no escape, which launched a doomed rescue effort that would take 22 days and the heroic labor of hundreds of miners, engineering experts, women of the Red Cross, and the community at large. And whereas as many as 200 men from throughout the Mother Lode Gold region worked almost 3 weeks to reach the trapped miners, wheelbarrowing rock and debris through a tunnel too narrow to allow work carts and too low for the men to stand up. And whereas the Argonaut mine rescue attempt drew worldwide media attention to Jackson, California, with an army of reporters and motion picture crews arriving by plane, train, and automobile and motorcycle to cover the tragedy which remains the worst mining disaster in California history. And whereas the 47 miners who died in the disaster were mostly immigrants, listing birthplaces in 13 countries and representing the cultural melting pot that remains in Amador County and California. And whereas in 1922, California Governor William Stevens appointed a special committee to investigate the conditions in the mine and causes of the disaster, releasing 17 mine safety recommendations, which began a decades-long progress towards federal regulation and safety enforcement in the mining industry. And whereas between August 27th, September 24th, 2022, on the 100th anniversary of the disaster, a collaboration of Amador County civic, historical, religious, and arts organizations are planning memorial and living history events in Jackson to commemorate the lives of the 47 men lost and the impact of the disaster on the community and the mining industry. Therefore, be it resolved that the Board of Supervisors of the County of Amador, State of California, does hereby join with the citizens of Jackson and Amador County, the descendants of the Argonaut miners and rescuers, and the Argonaut Mine Disaster Centennial Commemoration Committee and recognition of the events commemorating the 100th anniversary of the Argonaut Mine disaster, memorializing the lives lost and the physical and spiritual effort expended in the rescue effort. And the foregoing resolution was duly passed on this day. So with that, I think I need a motion to do that.
Make a motion to approve the resolution.
Second.
Moved by Supervisor Axe, second by Supervisor Cruz. Sorry, Brian, he beat you in there. Any discussion on this item?
Sure, I have a little bit. This is Supervisor
Okay,
Ornetto.
go ahead.
You know, even though you're talking something that happened, you know, decades ago, there's still a lot of people in Amador County who had relatives, you know, that died in that mine. So yeah, it's a pretty big deal. It's a tragedy.
Yes, it is. Any further comments? All right, all those in favor of passing the motion, say aye.
Aye.
Aye. Roll call again. Thank you. Vice Chair.
Supervisor Crew,
Aye.
Supervisor Forster,
Aye.
Supervisor Brown,
Yes.
Supervisor Axe,
Aye.
Supervisor Onetto.
Aye.
All right, motion carries 5-0. Thank you. Move to item 4C, the minutes. I had corrections. I've submitted minor corrections to our board clerk.
I had some minor corrections too, so.
Okay, can I get a
Move to
motion?
approve with corrections the minutes.
Second.
Moved by Supervisor Axe, second by Supervisor Brown to approve the minutes with minor corrections. Roll call, please.
Supervisor Crew,
Aye.
Supervisor Forster,
Aye.
Supervisor Brown,
Aye.
Supervisor Axe,
Aye.
Supervisor Onetto.
Aye.
Motion carries 5-0. We'll go to our addendum, item 4D, Administrative Agency, consideration possible action supporting Measure J.
Yes, Supervisors. So the deadline for arguments in support of this ballot measure are today. And so we added this as an addendum. I took the argument in support that was submitted by the Board of Supervisors from 2012, when this was last on the ballot. This is essentially it. I have gotten the updated numbers from our code enforcement officer, who also is the Land and Vehicle Authority officer as well. And she says that the total number since 1992 is 4,637 vehicles. And then she also added that the 2021-22 fiscal year, it was 115 vehicles, and the 2020-2021 fiscal year was 170, which isn't in the blank, but if you wanted to add that. And then she provided all the resolutions which are included from the incorporated cities. I did see that there was one typo on the on the, below the, listing the support, it says the Amador County Board of there's missing an S there at the end, yeah.
Thank you. Any
Oh,
questions?
So the board can, support a ballot measure, at a public meeting. You can do this. It's added for you to decide whether you want to, and if you want this version or something different.
I thought the purpose of this was just to, put our statement in support, so, and you already made that, constructed that.
I drafted it for you, but you could certainly do anything the board wants. This was what was submitted as the argument in support in 2012, updated with the numbers. 4,637 total, and the 21-22 is 115 vehicles.
Yeah, I prefer not to get any stronger than that. I think this is a common sense issue, and people should view it as such and not be overly coerced or feel like they are by our board.
Right, but this is also the resolution to call the election too, to set the election.
The resolution you approved at the last meeting,
Oh, it was?
and
Okay.
then that triggers all the
That's it.
dates. The date for the arguments in support is today.
Okay.
So we had to put this back on. The resolution is just there, as background.
Got it.
Yeah, I think what you have there, Greg, is fine. I mean, just kind of lays out what it's about and why, and put before the voters, and the voters can say yay or nay.
And the good thing is all 5 cities have acted in favor of this with resolutions.
Yep.
So any further comments from the board members? Any public comment? Hearing none, board action.
Yeah, I'd make a motion to go ahead and approve what's before us. The resolution. Yeah, putting forth that argument in favor.
We've already, at our last meeting, we acted to call for an election, right?
Yes, this is going to be on the ballot, but if you wanted to add so in the handout, the ballot handout, there's a spot for arguments in support or arguments opposed. And in 2012, the Board of Supervisors did also submit an argument in support. It's just this little blurb. The resolution has already been done. Yeah.
That was part of my motion.
We're
too,
approving
our
adding the section for support.
Yes.
And Supervisor Oneto, you're clear on that?
That was part of my original motion.
That is your motion, so, okay.
It is the motion.
Yeah. All right, moved by Supervisor Oneto, second by Supervisor Crew. Any further discussion? Roll call, please.
Supervisor Crew,
Aye.
Supervisor Forster,
Aye.
Supervisor Brown,
Aye.
Supervisor Axe,
Aye.
Supervisor Oneto.
Aye.
All right, motion carries 5-0. That is it for today, folks. Greg, you're looking around. All right, we have closed session items to wrap up. So with that, our open session is over for today, and we will take a short break and then resume in the closed session.